Hi guys, welcome back to Educate channel. So today we will be discussing about joint ill or navel ill. So if you haven't subscribed our channel yet, feel free to subscribe and hit the bell button. So moving to the cause. Navel or joint ill is actually a disease of the young calves that is usually less than 1 week of age. So they will contract this disease during the age of 1 week nearly. But sometimes these problems will go to the chronic action. So it occurs as a result of infection entering the umbilical cord soon after or at the time of birth. So this infection can result in a range of signs depending on where the bacteria spread to. So prevention is actually by maintaining a proper hygiene. So ensuring that the cow calves in a clean environment will significantly reduce the risk of joint ill and many other diseases such as toxic mastitis and metritis. Proper planning and preparation can prevent the buildup of disease. Okay. Then applying a disinfectant to the navel area can reduce the risk of bacteria entering via the navel. But it is no substitute for actually good hygiene. So no amount of disinfectant can overcome being born in dirty wet yard. Applying disinfectant 2 or 3 times to the bulls can reduce the risk. So finally, it is also important to ensure that if the cattle are born in a nice clean environment, they aren't moved to other pens or contaminated pastures until the navel has dried completely. So we should actually check the navel area. Whenever a small type of wound is present on the navel area, the high chance of getting bacterial infection is there. So navel ill, that is if infection stays mostly confined to the navel, the primary sign is swollen, painful navel that does not drying up. An abscess may develop from which pus, often a thick custard-like, may burst out. The calf may be having higher temperature and reduced appetite. So joint ill, if the infection spreads from the navel or navel is not treated, further signs will develop as bacteria spread via the bloodstream and settle in other parts of the body. The commonest sites for bacteria to settle are the joints mainly in the synovia. This leads to swollen, stiff, painful, that is often joint ill. Temperature will be raised while the bacteria spread, but the time of the disease is noted. It may be normal actually. So loss of appetite will be there, depression will be there. So, so treatment is actually penicillin for 5 to 7 days, the best antibiotic for umbilical infection. Other antibiotics may be prescribed by veterinary surgeon for calves with meningitis and polyarthritis following septicemia. If at all the condition has gone very bad, that polyarthritis is also there, then the veterinary surgeon will change the antibiotic and he will be prescribing some other medicines also. So what is infectious arthritis? That is very common whenever the joint is not treated properly and the pus is not drained out. So the bacteria and the pus will be taken to the systemic circulation and that will lead to septicemia and many joints will be having infections. That is actually infectious arthritis and the procedure by which the body's own immune system to work against the bacteria will go less since it is a very juvenile calf. So we can see a draining video. So this is actually performed by myself and with the help of our senior doctor. So you can see this is actually the joint. First of all, we are having some spirit and alcohol on the abscess. So it is having age of 2 weeks, 2 to 3 weeks age nearly. So first of all, we'll be inserting a syringe and looking for the type of pus. Yes, you can see the yellowish color purulent pus inside. So the owners having looked for that animal much properly. So the condition gone worse and those big abscesses having completely pus. You can see whenever the abscess is pressed, pus is coming out like hell. So this condition is actually the joint ill condition and the animal will be having pain because the synovial fluid will be containing mainly pus and all. due to the abscess present in there. This is actually the video taken in Wayanad district. So you can see the pus coming out. Animal will be having high pain because we are directly inserting the needle and taking out the pus. You can see the surgeon is completely removing the pus and all. Now it will be treated for infectious agents and antibiotics will be given. So thank you guys.